it might be in the future when more studies are done, the genome project, you can do genetic engineering or re-engineering, but as we speak, it's not preventable, but blindness from glaucoma is avoidable. And that's why we are pushing and campaigning every time. I don't want to continue to see people come to my clinic as they go to other clinics blind from glaucoma. At the stage which you really can't help them, when you know that there's a lot you could have done if you have seen them earlier.
If you had seen them earlier. So for the layman, for the person who is hearing about glaucoma for very first time on this form, it would be like, what is glaucoma? That is not preventable, but blindness from glaucoma is avoidable. What is it really? Is it a disease? Is it a virus? Is it, what exactly is it?
Glaucoma is a group of diseases affecting the eye. And the problem with it is that the main problem with glaucoma is it causes significant damage to the optic nerve, which is the nerve number 2 in the brain that we used to see. The reason why it's in our domain as eye surgeons or eye specialists is because that's the only nerve it affects. And the only function of that nerve is sight. So it's a group of diseases. By doing damage to the nerve can cause visual loss progressively until it causes severe visual loss, leading to severe visual disability. And at the end of the road, if appropriate treatment is not offered, patient goes blind, irreversibly blind. The point that it is irreversible when it causes blindness is the reason why we are always out talking about it. So glaucoma is an eye disease, is probably the second commonest cause of blindness in the world today. It's very rampant among black people. As a matter of fact, one of the predisposing factors to glaucoma is being a black person.
Interesting.
Yes, it's being a black person. It's far more prevalent among black people. It's more difficult to treat among black poor people. And the outcome of treatment, unless you are really aggressive, possibly do surgery, the outcome of treatment with eye drops are not as satisfactory as in other races.
So I remember you mentioned 80% of the world population suffering from glaucoma.
80 million.
80 million.
Yes.
Sorry, 80 million.
That's right.
Don't be angry. And then 5 million have gone blind.
Yes.
So out of this number, you are saying the majority are black people.
Yes, that's right. A lot of people that are blind from glaucoma today are in sub-Saharan Africa.
Interesting.
Yes. Not just because glaucoma is commoner among people of black African descent. The level of awareness among our people is still quite low. That's number one problem. Number two, the level of healthcare service we have across board in many countries and many parts of sub-Saharan Africa is less than required. For instance, let's look at the budget for our country, for instance. Our budget for a year in our country still ranges between 4 to 5% of the total budget. Whereas WHO is advocating 15% of the budget. I believe that if government has more money, they obviously will want to put more money in health, because there are a lot of competing issues, safety, infrastructure and all that. So those are issues. The other issue is that because people are not aware, they don't go to do eye check. They may go and do all of that. The last time I came, I was emphasizing when I was talking about love your eyes, that just as people go and do their, health check from time to time, they want to know their BPs, they want to know that. They should also extend the same thing to their eyes, okay, and do their checkup, including the state of their vision and the state of their eyes, because one of the three focal points on this glaucoma awareness month is to emphasize the fact that if we see patients with glaucoma early, we have a far better chance to preserve the vision. But if you don't see them on time because they are not aware they have the disease, then they present so late. By the time you are seeing them, many times in our clinics, they already lost one eye to glaucoma. So you have only one eye now that you are struggling to keep alive. So those are the issues that we need to push in this January Glaucoma Awareness Month.
Okay. As much as like you said, you can't prevent glaucoma. What are the signs a patient gets to experience and they know that I think this definitely is glaucoma?
That's a major part in glaucoma care or in glaucoma study as a disease. Glaucoma in a typical sense doesn't have symptoms in time. Before people know anything is wrong with their vision, they probably lost 50% of the nerve. Mm-hmm. So there are no early symptoms. There are no early signs that the patient will notice. And unless the patient schedule a visit to doctor regularly, from time maybe once in a year, depending on whether it has one of the high risk factors, like age. From the age of 60, people are more vulnerable to develop glaucoma. As a matter of fact, it is said that from age of 80, 1 out of 8 of every population, every population of people above 80 years, 1 out of 8 of them are at risk of developing glaucoma. So age is a serious risk factor. Race is a serious risk factor. And if you have a positive family history of glaucoma, that is to say, somebody in the family where you come from has suffered from glaucoma before, you're at a higher risk of developing glaucoma. Finally, if you have some disease condition like diabetes and hypertension, you're also at a higher risk of developing. So one of the issues we are pushing at this time is that people from the age of 40 should be having their eye checked by an ophthalmologist or any eye care professional who can diagnose glaucoma. Because if we see it on time, we have a far better opportunity and to preserve vision. It is this lack of symptoms that make us to describe glaucoma as a silent thief of sight. And that is the same reason why this January glaucoma awareness month this year is called Fight the Sight Stealing Disease. Let us fight the sight stealing disease. It sneaks in like a thief at night and begin to damage the nerve and take away the sight when the person is totally unaware. But now he knows what is going on, he has lost significant part of the nerve that's supposed to be using to see, and before you know it, quality of life can begin to depreciate. Even it can even affect his work.
That's a lot. So you have mentioned some risk factors. I remember you mentioning age, yes, and of course your race.
Yes.
That possibility and the fact that this glaucoma does not present symptoms early enough, or it is until it is far gone.
Yes.
What then? I mean, yeah, you said we should go for regular eye checks and all of that. Have you ever had a case where it just came up suddenly, maybe after their past eye check, nothing was spotted, and then it just shows up?
It doesn't usually happen like that. Having said that, I must also say that glaucoma is not one disease, a group of diseases. But let's talk about the primary one, that is the one that is not secondary to another disease. That one we can divide into two main groups, the primary open angle glaucoma variety and the angle-closure glaucoma. The angle-closure glaucoma can come the way you describe it and come with pain and discomfort and diminution in vision. It can happen. But it's a minority of cases. A large percentage of patients that have glaucoma have the primary open angle glaucoma variant, which starts very slow. It has 5 stages. Okay? It has an early stage where you are not sure whether it's here or there. Then it has an intermediate phase where you need to suspect, this cup is looking suspicious. Then it has the advance of the established disease stage. That established disease, you are sure, all the parameters will show that this patient is suffering from glaucoma. And that's the time to move in and do something. When you fail to do that at that stage, it then moves to what we call the end-stage disease. By the time it's end-stage disease, the patient is now suffering severe visual disability that can affect the quality of life of the patient, can affect his ability to work and earn income. And then the last final stage, which we don't want to see, is the blindness stage. So that's why this January glaucoma Awareness Month. The main focus of this Awareness Month is to use the opportunity to educate people about the risk of glaucoma and the impact it has in their lives, because it does cause significant visual disability. And they say awareness is the first step to action. The next thing we should now be looking at, okay, this month, glaucoma awareness month, January, is a call to action. It's a call to action. So we can now look at what levels are people supposed to be taking the action. At individual levels, yes, we want people from 40 and above to go see eye doctor and check their eyes. If they do not fall into any of the categories I've mentioned, especially if they don't have anybody in the family that has glaucoma, they don't have systemic hypertension disease, they are not short-sighted and all that, we can do it once in 2 years.
Once in 2 years?
Yeah, but if they have any of those risk factors, we advise them to check their eyes at least once in a year. Then at the community level, we want community people to participate in this campaign by sharing experiences and sharing information. We have in every community people who have suffered glaucoma, have been on treatment. Some of them have had successful glaucoma surgery, and their vision is preserved. Such people can now serve as our ambassadors in the community, talking about glaucoma and the choices of treatment that are available, and dissuade people from the notion that once you do surgery in glaucoma, you go blind. That's a big problem. And then finally, at government level, at public level, because it's a public health problem, we need to do more advocacy and get more people, including NGOs, to get them behind this vision of pushing glaucoma campaign to raise more awareness and to make it a call to action.
Okay. Now that you've mentioned, I remember knowing someone who was diagnosed with glaucoma, and she said at some point everything around her became blurry. So she knows you are seated there.
Right.
She can see there's a figure there. Making out the face of the figure, except you speak, that's when she recognizes your voice and all of that. And she was already old. I would like to ask, this awareness, is it also, is it everyone, all inclusive, old, young, whether you're before 60, whether you're above 60 and all?
That's right. Even though we said age is a risk factor, the older you get, the more vulnerable you are to develop glaucoma. There are other factors. Having said that, glaucoma doesn't just affect elderly people. There's a variant of that primary glaucoma that we call juvenile glaucoma.
Interesting.
That's right. And it can start from the age of 5 to the age of 35.
Wow.
All right, yes. I've been privileged to treat many patients in that age range. I've operated a child at 8 years, many years ago, for glaucoma successfully. I've done 30 years, I've done 40 years, I've done undergraduate, I've done young bankers, I've done young undergraduate, I've done young doctors, over the years, who are even below 35. So we have a variant of this disease that occur at a younger age group. That is still primary disease. It's not secondary to another disease. It's a primary disease. So when we have juvenile glaucoma, it occurs de novo as a primary disease within age group of 5 to 35 years. So age is a factor, but it's not necessarily old age. So that's why we say anybody from 35 should be checking their eyes. And if there's any history of glaucoma in their family, they should do it more frequently because they're at a higher risk.
So, we've talked about glaucoma not being preventable, but losing your sight to glaucoma is avoidable.
That's right.
When a patient presents himself or herself at an eye clinic, or is it always surgery? Are there other remedies?
Of course. Glaucoma care does not start or end with surgery.
Okay.
We have different treatment modalities. There's a place for medical treatment. And there are eye drops that have been developed to help to reduce the pressure, bearing in mind that the only aspect of glaucoma disease that we can deal with is the pressure. We call it the only modifiable risk factor. Because in a large majority of glaucoma patients, the pressure in the eye is a bit more elevated than the average or than normal, what we can call normal in quote. So, studies and experience have shown that if we can apply any treatment method or any treatment option to bring the pressure down in the eye of a patient with glaucoma, we are moving towards preserving the vision. So there's a place for medical treatment. There's also a place for laser treatment. The two of them, one can even complement the other in some patients. So those two options are there. There's a place also for surgery. But let me say this clearly. Surgery remains the most effective and the best treatment option for glaucoma anywhere in the world, but particularly with people of African descent, like you and I. So I want to use this opportunity to disabuse the mind of many people who have been misinformed and misguided that if they have glaucoma surgery, they will automatically go blind. It's the other way around. Because I can speak as somebody who has been on the trade for many years. In the last 23 years, I've been back in the country, and I've been involved in glaucoma care. I've done a lot of surgical procedures for glaucoma successfully. Some of my patients are in their 80s and 90s now, and some of them still come to clinic, and they still keep good, excellent vision with full pressure control. So we have different treatment modalities, different ones. And you don't necessarily have to start with surgery. You can start with medical treatment. You can do laser. That's what we call laser, selective laser trabeculoplasty. It's available in some clinics. It can be done. But what is more important is this. Glaucoma is a lifetime challenge. It requires a lifetime care. So even after you put your eye drop, or you've done surgery, or you've done laser, sometimes you need to do a little bit more. You may need to put the patient on some supplement that can help to rejuvenate the nerve. You may need to go in and do rehabilitation in some patients. It's still part of glaucoma care. So it's a lifetime challenge, and it requires a lifetime care. That's why we don't distract glaucoma patients from our service. We don't say you are okay now, you've done surgery, your pressure is fine, don't come again. That doesn't happen anywhere in the world. Because like I said, it requires a lifetime care.
It requires a lifetime care. And dear Dr. Jeff, permit me to open the phone line so the listener can call in and be a part of a conversation. 0817 923 0002 and 0817 923 0003. Again, 0817 923 0002 and 0817 923 0003. WhatsApp and Telegram number is 0809 030 6416. Again, WhatsApp and Telegram number is 0809 030 6416. I'm still in the studio with Dr. Jeff, an ophthalmologist, because this January, the shortest January in the history of Januaries, in the history of Januaries, is Glaucoma Awareness Month. And he is here again to create that awareness so you know not to lose your eyesight because of glaucoma. Nigerian info, good afternoon to you and welcome.
Good afternoon.
Good afternoon. Go ahead.
Yes, I thank Almighty God for bringing up this program. I have somebody that has glaucoma, but there has been treatment disagreement that made us to stop to make any move between the ophthalmologist. We went to the first person. He said that glaucoma does not require operation, eyes operation. So we went to another person because we decided to go to two persons to find out what to do. The other person said it requires operation. So we are confused of the treatment. This one says it requires operation. The other one says it doesn't require operation. So I thank God for this platform that we have this doctor. My question now is, does it require operation or it doesn't require operation? That's my question to our guest in the studio.
Thank you. Thank you so much, Dr. Jeff.
Thank you very much for your question. It's an important question, and that's one of the reasons I'm here. You will recall that when I opened up, I said one of the reasons why this awareness is important is to disabuse the mind of people in the public who has been misled, who has been misinformed that there's no place for surgery in glaucoma care. It's a fallacy. In fact, I would say it's a lie from the pit of hell. Because I say it and I say it boldly. Surgery remains the most important, the most effective treatment option for glaucoma anywhere in the world, but particularly with people of African descent. Now, where the confusion comes is this. We have a lot of people now that are involved in eye care. And let me zero in on two who are doctors. We have the optometrists who are not medical doctors but are trained as first line, like primary eye care professionals. Their training does not pass through the medical school and the exposure to treatment options for diseases. So they have a place, an important place in eye care, but they don't have a real place in glaucoma care. And I can say that anywhere. Now, some of them keep on confusing the public to say there's no place for surgery in glaucoma. And I'm amazed because there's no medical textbook that you can read glaucoma and talk about treatment that will not give you those three options. Medical, laser, surgery. So I may bold to say that glaucoma surgery is a vital treatment option. It's a matter of fact the best treatment option.
All right.
Anywhere in the world, particularly among our own people.
All right. Final caller, Joe from Mukrushi. Go ahead very quickly.
Okay. I know somebody who used to see something like ants, and later it multiplied, and it got to a level where he used to see something like strands of hair, while when he's looking at something. So, and then
Oh dear. When the caller said ant, I saw your facial expression. So.
Yes.
We may not have him back because we are pressed for time already.
Okay.
So.
Okay. Just in case he's listening, can I just spend a minute to say something?
Sure.
Okay. If somebody is saying you see like something like ants, or if you look at the page of a book, you see something like cobweb, that is due to floaters in the vitreous. And floaters can arise when a patient, especially middle-aged people, mainly women, have what we call posterior vitreous detachment. When the gel at the back of the eye pulls up, it can pull up with the pigment, and they can see all manner of shapes. Some of them can say they see something floating like a bat, something like mosquito. Those are floaters. In a large majority of cases, they are due to what we call posterior vitreous detachment. They will settle down. They don't usually cause visual loss, at least not on permanent basis. So, on a good day, seeing floaters is an innocuous symptom. But there may be other diseases like glaucoma, like retinopathy, or due to diabetes and all that may cause blindness.
All right, thank you so much, Dr. Jeff. Unfortunately, we are pressed for time at the moment. So final words from you as we round off.
Okay. What I would like to say is that glaucoma is in our midst. It's a sight-stealing disease. And we must all join hands to fight this sight-stealing disease.
This glaucoma is in trouble.
He sneaks in like a thief at night to take people's sight away. So people must be aware, and they must be aware that it's good to check their eyes. And also, finally, they must change their orientation and stop believing in a lie that there is no surgical treatment as an option for glaucoma. The truth of the matter is, glaucoma surgery is the best treatment option for glaucoma in black people.
In black people.
Yes.
And yes, remind them about checking their eyes so that they don't lose their sight.
Absolutely.
So this sight thief.
Silent thief of the sight.
Silent thief.
Of sight.
Of sight.
That's right.
The emphasis on the thief.
Yeah.
All right, we look forward to more conversations around glaucoma. Someone says, how can glaucoma be avoided? Okay, is that a question? Yes. Good afternoon. How can glaucoma be avoided? Okay, you heard Dr. Jeff earlier. He said you can't prevent it, but when it does happen, you can work something out so it doesn't steal your sight.
It doesn't make you go blind.
It doesn't make you go blind, simply put. Thank you again. And like I said earlier, we look forward to more conversations about glaucoma. Dr. Jeff Ajewole, an ophthalmologist practicing for over 40 years.
Thank you very much.
Thank you too. And that brings us to the end of the sunny side today. Rivers today comes up at 3, and thereafter Hard Facts with Sam Oracle Chinedu. I'll be back here tomorrow on the sunny side. Do enjoy the rest of your Thursday. On X, we're at Nigeria Info PH, and our Facebook page remains Nigeria Info 92.3 PH. On Instagram and Threads at _Nigeria Info PH. On Instagram and X, I'm _Denise_Dennis. Facebook page Denise Dennis, and Facebook account Denise Dennis Waller. Enjoy the rest of your Thursday. Adios.